Sophie Deloney. Why do you think there's such a lag time between the resources pledged or committed and for it to be translated on action in the ground? And you said there was a spike in pledges in September, but yet there's still been a delay in seeing the effectiveness. And then the second question is to Dr. Blyden. You're talking about an issue that is rarely discussed in terms of some of the impacts of, as you referred to, the eco-disruption, the activities of the mining companies. Do you think there's a way to get some of these mining companies to be liable for the outcome, the results of their excavation activities? And also, in terms of what you said and the bat theory, how does that connect or translate? And then to anyone on the panel, are you optimistic? And if so, please tell us why.
I wish I know the exact answer, but at least I can share with you our feeling and some of the elements that we think have consisted in obstacles to the response. The outbreak was identified in March, but as far as our organization is concerned, it's only at the end of May that we realized that it was out of control. So we already, lost 2-3 months. And then we've tried to mobilize the community, the ministries of health of the 3 most affected countries, and the World Health Organization. And, as we experience here, the main reaction to this type of disease is fear, is misinformation, is sometimes denial, including from the population who denied at first that there was a real outbreak, and it was very difficult to convince people to go and get treated or at least admitted in isolation center because they would see the admission as a death sentence. So this is why there was a need for a lot of awareness. And unfortunately, it took months before the World Health Organization recognized that it was an international medical emergency. It was only in the month of August. But then when there was this recognition by the World Health Organization, it took another month to mobilize the whole international community. We're just an NGO, right? And it's a huge challenge to convince countries, policymakers who have a lot of other emergencies going on that there is an emergency in West Africa and they need to step up. I think that, and even though I speak from the United States because at that time I was involved here in trying to mobilize the US government. The CDC already was very much active on the ground with us since the month of July, right? They've been extremely instrumental in the response also, but other agencies were not so present there. And although we were having a constant dialogue and there was a good understanding and recognition that there was a need for further assistance, a country like the United States is not going to mobilize a huge amount of resources if it only, because an NGO is asking. And I personally think that in the case of Liberia, the official call from President Johnson Sirleaf was a trigger to the American response. So there's been all these sequences of actions that have delayed the response along the way. And since the response, since the international community has acknowledged the magnitude of the crisis and committed to respond, which happened in mid-September, the response has been too slow despite the efforts of these communities, simply because of logistic reasons. As you know, airline companies were erratically functioning in the region. A lot of airline companies were stopping, so the logistic was difficult. We were facing with a lot of bureaucratic challenges also on the part of the governments who were trying to develop a response. And last but not least, the most effective way to address this type of outbreak is to have some trained professionals on the ground. And there is obviously still now a gap between the resources, the human resources that are necessary to tackle this outbreak and the amount of available trained and skilled professionals.
Thank you, Dr. Blyden, and I want to thank Bill Perkins. You've been staying here the whole time. Thank you very much, Senator. Go ahead,
Dr. Your question was about the impact of disruption of the environment and the ecosystems in these forests and its relationship to mining. Well, in 2005, 2006, I was a professor at the Jala University in Sierra Leone, and was also in charge of a forest conservation effort in the Gola Forest, actually basically where this thing has emerged. And we were also, I taught environmental scientists, and we did things like impact assessments and so forth for some of the mining companies that were just returning back to Sierra Leone after the disruption of the Civil War. And the problem is that, you know, the income of a country like Sierra Leone, a lot of our income comes from mining. There are strategic metals that are found, rare metals that are found in Sierra Leone. Rutile is one of them, from which titanium is made, which obviously is a very important strategic metal for the United States and other countries that build aircraft and weapons and so forth. And the other strategic metal we already mentioned today about your cell phones, it is actually found in Sierra Leone. And of course, the last time Sierra Leone was in the New York Times was in relation to our blood diamonds, which you're all familiar with. But I want I want to take this opportunity to make you all aware of a new initiative that's just been started by the Intel Corporation, which is basically modeled on the same idea that we had for illicit diamonds, so blood diamonds. They have started to try to put certification on coltan, which is the ore from which these antennas in your phone are made. So they're trying to help you to make a choice between legally mined ores versus illegally mined ores. To give you some idea of how much you are culpable as a cell phone user, since the time cell phones were invented, which was sometime in the middle of the 70s to now, it's estimated that 5 million people have lost their lives in conflicts which could either directly or indirectly be related to obtaining coltan at illegal prices. One of the biggest culprits was Nokia for a long time. I understand they've cleaned up their act. But if you search on Intel and this idea of illicit sources of minerals, you will find that. So the bottom line in all these situations is that, yes, on the one hand, the governments may recognize that this is a bad thing, but they're sort of caught between a rock and a hard place. You know, you give up the forest in exchange for revenue from ores. Needless to say, there's a whole bunch of corruption that goes along with that. A small country like Sierra Leone, really, our nationhood is in the global age is frankly meaningless. If the government of Sierra Leone really wants to put its foot down, they're probably not going to last very long. Somebody who really wants to do something, they're just going to come along and do it anyway.
Thank you very much. There was a woman right over there. Yes, go ahead. Sam.
All right. I'm going to make a quick statement and also ask a question. My name is Maima. There's a saying that's going on like Facebook and Twitter. I am 100% Liberian. I am not a virus. What most people forget, that this is not just only a disease, it is affecting families. There are children dying. There are mothers dying. There are fathers dying. There are children that are orphans today in these 3 countries. And we're talking about 4 or 5 people that are getting the best care in the world. And people are losing their mind over 4 or 5 people with something that they're not going to get. When people, a whole entire nation and a region are losing their lives and their financial ability. Children are not in school today for 6-7 months. So this is more than just a few things Or am I going to get somebody to sneeze on me on a train? There is more than that. So my question is going to where the real problem is: Liberia, Sierra Leone, and Guinea. What can we do to help more people over there? What are the equipments that are needed? Somebody mentioned ambulances. Is anybody reaching out to ambulance companies to see if they can be donated? Boots, gloves. I want to know what I can do in my space to donate, to get to these countries that need the help, so people are not sneaking on planes, getting somewhere else, and they will bring it over here if they're not getting what they need to fight it over there. So what can I do?
Dr.
What
Stone,
are
do
the
you wanna
organizations that are working to get things to these
Thank
countries?
you. Dr. Stone, I just want to say one thing that I believe is going to happen, which is that Mayor de Blasio is going to suggest that all city workers have a checkoff on our paychecks so that we can donate to the correct nonprofit to be able to support exactly what you're stating, because that is an incredibly important question. Thank you. Dr. Stone, go ahead.
Well, I'm also a Liberian, and I'm not a virus. But, and I actually have been directly involved in Liberia. I was there the whole month of April. I was there the whole month of August. And I'm going back again. So, life belongs to the brave. I'm unafraid to go into Liberia. What can you do? Basically, there are so many organizations in Liberia at the moment. There's a lot of money that has been allocated through the UN, through the US government, and all the British government, the European Union. And, if it's about getting protective gear and the things that are required to run an Ebola treatment unit, most of the organizations that are charged with that responsibility, that have the responsibility or memorandum of understanding with the government to run these units, have the means to bring them in. What is required, really, I don't know if you are aware, but there are over 2,500 Ebola survivors in Liberia. And they're in the process of forming a network, establishing a network, because people don't want to manipulate these people because their blood, like the diamonds, has become gold. And so there are people who may be having conversations as to galvanizing support to bring people over here to do certain things with people who have had Ebola. So one of the things that I am encouraging people to do is to find a way to support the Liberian Ebola Survivors Network. There are probably about 3,000 of them now, and it's headed by a young man named Kolya Bonawolo. It is run through the Ministry of Health and Social Welfare. They need a lot of support. They need equipment to have an office where they can actually be organized. And one of the goals that we have is to begin some kind of a research project with these Ebola, and Dr. Blyden and I were talking about that, to actually study them, and that is the area where I think if you want to lend your support, that is the area, because all these other organizations are there. Médecins Sans Frontières, has a lot of money. You don't need to give money to people who have a means of collecting money. You need to give it to the organizations within Liberia that themselves are, these guys have lost their whole families, for example. Some of them have lost all of their family. There's one guy who lost 7 members of his family, and he was the only one who survived. Nobody is supporting them. The other thing that you can do is to give your support to the psychological, psychosocial support through UNICEF. UNICEF is spearheading the psychosocial response. The health workers are not being supported. The burden of disease is very heavy on people who are actually administering the care on the front line. The burden of disease is very heavy on those people who have actually had Ebola and lost their entire families. So if you want to give money to an organization, in particular, UNICEF is spearheading that psychosocial response for Ebola in Liberia.
So what we'll do, Dr. Stone, is we will put on our website the contact for both organizations, and then we'll be able to donate directly to them. And really, thank you very much. That's really helpful. Somebody in the back? Is there anybody in the back? Yes, in the back there, there's a woman with a coat and a green shirt. Right there. Yes.
Hi, my name is Arao. I'm from Uganda. I'm part of the Ugandan community here in New York City. My question is, I'm also a journalist. My question is, what is the city of New York doing to prevent bullying of African kids in the Bronx? I live in the Bronx, and also, is the city going to be helping teachers introduce lesson plans on Ebola to prevent stigma of African children? I volunteer at a lot of the mosques and the churches in the Bronx, and I'm hearing a lot of stories about bullying. I'm just wondering if the city is going to be helping teachers introduce that topic, especially through lesson plans. And also, is there just going to be a general training of teaching staff to just prevent more African kids from being bullied in schools? Thank you.
Okay. Commission, thank you very much on human rights.
The answer to these questions is, first, yes, we are going to be working more on that. There are new materials that we are developing even now. I was speaking with Commissioner Gatling this afternoon, and she's quite anxious to get us more into the schools on this topic. I can't give you tonight specifics on how the lesson plans and other materials are going to be developed, but I can say this. Bullying in this instance is being triggered by fear and bigotry over this terrible disease. But bullying at bottom is still bullying. And that is something that our office has been working on steadily for years. And we have some materials up top that will show you about that. But we have various programs in the schools already that deal with that, including our peer mediation program that tries to get students themselves into a conflict resolution situation so that they can prevent things from escalating over a variety of issues. And there's no reason why we can't incorporate these issues into any of the curricula that we deal with in the schools.
Thank you. I know that the DOE sent out a letter today, and let me tell you, I am going to follow up. We're going to follow up to make sure that in this community on Borough Manhattan, no bullying, and we're going to be taking it very, very seriously. I thank you for that.
Yep, right here in the gray
Yes.
shirt.
I am Dr. Charlotte Martin here at City College, and I am a librarian. I'm not a virus either, but although some people might think I am, but that's beside the point. I want to address the issue of food in terms of the victims of Ebola. I talk to Liberia these times almost every morning, and one of the concerns that I hear is that people who are infected do not go to the quarantine centers because they fear they're not going to have enough food, and they then stay home because they have that fear. So I'm asking Madier, how is that being handled? And the other thing I'm asking in general to the three countries, what kind of educational materials and forums are being held in those situations to educate the populace?
Dr. Stone, you again. Thank you.
Well, the Ebola treatment units, or otherwise known as ETU, have adequate supply of food. But if people are identified within communities, what they're trying to do now is to set up some temporary holding centers so that was when there were not enough beds. So that if people were within the community, they would be held over at these holding centers until such time there would be a bed in the treatment center. Now they have an excess number of available beds. So people are being encouraged to go to the treatment center because, yes, indeed, they do have food available to feed people in these centers. For people who are being isolated because they have been direct contacts of people who have died of Ebola, they have a mechanism in place whereby food is supposed to be delivered directly to their households. And I know that if they have a problem, if you know of anybody who has a problem with that, you can contact me, and I will refer them to the appropriate people in Monrovia.
Thank you very much. Right here, sir.
Good evening. My name is Amaha Kasa. I'm the director of African Communities Together, a membership organization of African immigrants based right here. We're members of the task force, so thank you, Borough President. Two things. One, I'd like to reflect to Dr. Maybank that I think there's an urgent need to increase the capacity within the Public Health Department for doing greater and more culturally competent outreach to organizations of Africans here in New York. We had our membership meeting this past week. There was some question about whether we could even get some, there's a few dozen West Africans, including a number from the affected country. It was difficult to even get a presenter, and the person who we ultimately got, without going into a lot of detail, was not culturally competent and reiterated a number of stereotypes, and it was a bit of a lost opportunity. So that, and then just briefly with respect to the issue of backlash, stigmatization, discrimination, and harassment, I just want to underscore that it's rampant. My own staff have been harassed on the streets. We work with a number of people who work in braid shops that have lost business. That's another segment in addition to the taxi drivers. And we are going to be starting a hotline. We strongly encourage people to talk to the Human Rights Commission, but for cases that aren't actionable but still should be documented and exposed and gotten publicity, we're going to be setting up a hotline. It will launch in the next week, and you can go to our website, www.africans.us, that's Africans plural, .us, and we will have the link to the phone and web hotline when that becomes available.
Thank you very much. If you want to answer, go ahead.
Sure. So thank you for the comment and the feedback. When we first started about 3 weeks ago, our primary focus, and Commissioner Bassett, this was very important to her, was that we did target the West African community. And there are many in this room that we actually have had multiple conversations with, and not just conversations over the phone or email, but coming to Harlem, visit, as I said, Javier Lopez, who's in the back, and other staff, Jaime Gutierrez, and a bunch of staff have come back and forth to Harlem, but we've also worked very closely with Staten Island, and we've been in the faith institutions, as well as the Bronx. We had the town hall last night. Any of the town halls that we've really participated in have been in complete partnership with our West African communities. We were very clear that we could not do this alone, and we didn't want to do it alone, and it didn't make sense to do alone. And that the voices of our communities really needed to be elevated on multiple levels, not just so the health department could hear it and the health department staff, but others. But I do want to address, and I think you bring up a very good point, as far as making sure and ensuring that what we do is culturally relevant and linguistically appropriate. And we are working through that. We have heard that from several angles. We have trained up lots of staff. And so we are now engaging more with our West African Health Department staff in an effort more so to hear also the concerns. What are the voices that are happening in the community? We heard yesterday from one of our staff that his daughter was jumped. And so there's a lot of information that we're getting, and so we're making sure that we elevate the assets that we have in our agency to, one, train and to be part of the Speakers Bureau. And we have mobilized our Medical Reserve Corps as well and providing training, which is 7,000 healthcare providers over the city. And so we do not only see the need for training about Ebola 101 to those who are going out there, but we are going to have to implement more. I completely agree as far as just making sure that how we talk, what we talk about is appropriate.
Thank you. Right
if
over
I
there,
could
sir.
just add on the more on the bullying aspect, and as Dr. Maybank just said, where a member of her staff had a family member who was jumped. Two things. And first, I can say as a former prosecutor that I did for 11 years, there is overlap between what we do and the criminal law. Know this, if somebody is physically assaulted, contact the police. Don't sit around about it. Don't feel guilty that it happened. You have a right to be free of that kind of violence. Anyone who does that should be criminally prosecuted. Do not think that you have to stay away from the criminal justice system. You are a victim of a crime, and you should proceed accordingly. Contact the police and your local district attorney so that they can deal with that. Also, I just want to add, yes, there are some things, as you said, that aren't actionable under our statute. And I'm very happy to hear that you're going to be tracking various things of that nature. For example, you mentioned the braid shops. We can't make people go and shop at a certain place. Now, if somebody begins picketing, does some kind of boycott of those kinds of stores, that we can do something about. If cab drivers, for example, have passengers who are with them and say, well, I don't want you to drive me anywhere, we can't make somebody be a customer. But if people come up and they start picketing cab stands and having people pick out certain kinds of drivers, that we can do something about. So I'm very encouraged, and I want to meet with you after the remarks so that we can discuss the network that you're setting up.
All right, the gentleman over here, and then we're going to have to, I think, close the questions, but go ahead, sir.
Thank you. I really want to ask this question that really goes to where I think it belongs, because the fear that we are all getting right now actually generated from when the governors of the two states got together and held that press conference that really went to the heart of the healthcare workers, who are really the frontline people in West Africa. I'm really emotional about this. And the governor of the state of New York did not even recognize that the United Nations really sits right here. And you have thousands of people who will be going back and forth from your states. We have to take some of these things into consideration when we make decisions like this that will affect the life of millions of people. People don't understand what has happened to Sierra Leone. People don't know. We have a lost generation of over maybe 50 years we are not going to recover out of this. So I really beg the governor of both states to really look at the healthcare, workers who are going back there, and really have some amount of compassion. Look how the way they treat that lady cook. Like the lady is a criminal. For God's sake. I'm apologizing, please. We have people who are going to be coming back from Sierra Leone. They just left, 30 delegations just left to go. Please, let's deal with these things with some amount of civility. I don't want to take anybody's time, but please, I'm appealing to both governors to really put some seriousness and some thoughts to. Dr. Kofi asked me a very simple question. I want to thank the Manhattan Borough President, Gail and Alassane Joe, Dr. Onyani here, and the director over there. Please, I want to thank these people because they did a wonderful job in putting this program together.
Well, we thank you very much. And I just want to add, before we thank our panel, and with a huge round of applause, Scott Stringer, Comptroller, had a representative here. Subconscious was sponsored by the West Harlem Assistance Group, and they provided the food tonight. The Mayor's Office of Community Affairs was here. I want to thank the Department of Health for doing the translation. Merci beaucoup, alors. And I want to say that the health workers, there are a lot of ticker tape parades for sports figures. We should have one for the health workers who go back and forth. They deserve it more than any, with all due respect, sports figure. There will be a wonderful group that's going to come and have a closing song. I hope that, I would love to see Dr. Kofi Botan come up, and certainly Nakaja, I want you just to come up, and also Alassane come up from our office. Nakachi to come up too, just to say thank you to all of you, but these are the people who made this evening possible. A huge round of applause for this amazing panel.
I'm sorry, 1 second, ma'am. One second. We like to acknowledge you, but we also want to first acknowledge the panel, which was what the borough president was saying, for their time and their energy and efforts, and also the organizers. This will not be the last opportunity that all of you have to follow up with us. We have actions to do ongoing. There are many people who would like to ask additional questions. The panelists will be staying as long as they can, and you should feel free to talk directly with those who are associated with your question. At this time, out of respect, we ask you just to please hold your question. I understand, and we appreciate you, but we know we're time limited. I understand. Yes. With all due respect, ma'am, we need you to please hold your question.
Okay. My sister. Thank you. Well said.
Let them know that we need international support. We need air, food, and water. We need airlift, food, and water into West Africa to help the people because they need food, water, fresh water, and build the body so that their families are not infected from the people who are dying and lying around in treatment centers, and the disease is spreading to family members.
Thank you.
We need, there are medical ships that can be mobilized. There are medical ships, almost like
Okay, you repeated yourself, sister.
mobilized by our government and other governments to go in with 2,000 or more beds on those ships to stop this disease.
Okay, thank you. You got a last word. Thank you. Thank you. Thank you. Thank you. Thank you. We also have to respect our host, City College.
I respect you, but we are...
You've said it. We've heard you. We've heard you. Please, we've heard you. Okay. If you will let me speak, you'll be happy about what I'm going to say. Okay, we are going to have follow-ups. We are going to have action steps. Well, you meet us in the back, we'll take your name, okay? And we'll call you and show up when we call you to do something too. All right. So we are going to have action steps by the task force. This is not the beginning and that's not the end of this. Obviously, there are a lot more things to do as we have all seen here. So first of all, we thank all of you for coming. We thank you, but please, okay, we thank everybody. And now I call up the groundbreakers to give us a rousing send-off. And thank you all for coming.
Okay, the panelists, thank you. Feel free to rejoin the audience. They're going to move the table back just so that the closing performance may occur, and we look forward to continuing the dialogue. And we want to thank Marlene and Tori Ricaldi and the rest of the staff, Sam, Jessica, I see all of you. If I'm missing anyone, forgive us. Thank you, all of the African Task Force, the African Immigrant Task Force members. Thank you so much. And you would want to stay for this performance because this is an epic song that will help to kick off our campaign. Thank you.